So we use single-use floss. We don't reuse them.
That's good to know. We appreciate that.
Yeah, thank you. But we buy that in large quantities. If we get these from Shine.
Can I take this off to do?
Yeah, it seems like that would be counterproductive. We don't put this pulse oximetry on the finger that we do the blood pressure, so that when we put the blood pressure up, it doesn't look like the patient quit breathing on us. So it's just a little. We're going to put some wrist clips on for doing EKG, and we get a whole bunch of information in one fell swoop. We did it. Have this floss, we can find some more. So basically what we do is I spray his wrist so that the electrolytic light fluid will touch his hairy arms and make contacts with these clips. This wrist clips non-invasive, and for the most part for what we're doing it does just fine. So basically we're going to get a blood pressure because there's nothing on this tape yet as far as blood pressure. So regardless of all this thing is getting set, I'm going to change the leads, and we're going to go over that in a minute about which lead to use for starters. If you get a blood pressure pulse and oxygen, you're doing more than most dentists. I got them on the wrong one. See how that's upside down? It looks a lot more normal when you do it this way. The white goes on the right. All right, but this is the way it's supposed to be. That's a QRS wave, and this is a SpO2 wave, and we're going to talk a lot about that, but right now it's searching for blood pressure, so we'll see what happens after quit squeezing the arm. It's not a really true thing, but it's all right. It's 136/90. He does take blood pressure medication, and now the air is out of the cuff. His pulse ox looks pretty good, and so what I'm going to do is print it. And basically, I have a book that helps me. I picked it up at one of the bookstores. Barnes & Noble probably has it. It's just for physicians. It's got everything in it. You ought to start looking at hearts, because basically you're affecting it every day with your dentistry, whether you never know it or not. So now we have a strip, and it's like a little scroll. This thing's hard to work with. So before I do anything, I'll take a minute and put his name on there. And then I put that this was without, obviously he doesn't have anything, but later I'll be doing strips with an appliance. So I want to see what this thing looks like before I start messing around. And sometimes you pick up things that you wouldn't ordinarily pick up, like his blood pressure is excessively high, or his pulse is excessively high or low. 80 is about optimum. 56 is not good. He doesn't get his blood out to his extremities. He probably has cold hands or feet, or a lot of people that have low blood pressure do. When you stand up, blood's not out there where it's supposed to be. You can take a spill. So too little water or too much water is bad for you. Too little blood pressure or too high blood pressure, it's bad for you. It's kind of a myth out there that says the lower your blood pressure, you're going to live 1,000 years. You're going to have cold feet, cold hands, and poor circulation. So I have a little cup hook. I just stick over here and nail it. And then my Joan comes in after I'm finished with a stapler and staples them all together. And then I have a dental EKG stamp, not for diagnosis, and stamp it on there, because I don't want anybody to think I'm doing cardiac stuff. What I'm doing is balancing oral function, and I'm using this to guide me as to how to balance oral function. And you'd be surprised how much easier it is when you have the assist of an EKG. You can still do blood pressure and pulse, because when you're affecting the blood pressure, usually, or the pulse, it's the pulse that usually is the most predominant one. then oxygen goes up and high pulse rates go down. The reason is the pulse is up is because there's a lot of adrenaline in there trying to get the blood around faster and faster and faster. It doesn't have a whole lot of oxygen in it. So if they're down around 93, 94, usually the pulse is way up. And sometimes it's the blood pressure that's way up. In his case, it is up, but it's up higher than normal, but it could be a lot higher if he wasn't taking medication. And we've had a conversation about if he's taking medication and he's got an appliance in, and the appliance is getting him more oxygen, then his blood pressure may start descending in spite of the medications, and he may take it down to a place that really is scary for him and anyone that's around him, and end up in the emergency room for no reason other than that he should have talked to his doctor about minimizing his dosage or working with him on getting off the blood pressure medication. It's not unusual to change blood pressure 10 and 20 points without anything other than the appliance. It takes a while to, work into that, but it can be done, and we do it regularly. And the pulse is another one. Somebody has tachycardia or a very high rate, and you give them some air, all of a sudden the tachycardia stops. I was with a guy at dinner in Tacoma, and we were taking a class, and one of his patients called him, and she was in a rural hospital with a nurse friend, and her tachycardia was like twice what it should be. Instead of 70 beats a minute, it was like 130, 135. They tried to get it down. We were worried she was going to have a heart attack. No medicine would touch it. They wanted to transport her to another hospital and give her a pacemaker. And the nurse that was with her, kind of alternative, said, "Hey, we were at your class, this other doctor's, and you said something about this affecting fast pulse rates. Is there anything we can do?" And he said, "Sure, yeah." He said, "Just get yourself a Kleenex and tear it in half." Very complicated, or just make spitballs, good fat ones, chew them up, put them on between the teeth, push your jaw forward, and call me back in 30 minutes. And when she called him back, she was checking out of the emergency room. She just got some air. Her body was really letting her know that she was in respiratory arrest, essentially. But so what we are talking about is very serious stuff. It's something that we should be aware of. When you lay that patient back in the dental chair, that tongue goes back there, they're not scaredy cats. They're choking, and they don't know it, but it's not the same. Their blood pressure's up, their pulse may be up, or vice versa, or both, and it's the adrenaline. They're just trying to, in the fight or flight.